Gingivitis is a common dental condition characterized by the inflammation of the gingiva, which is the part of your gum tissue that surrounds the base of your teeth. This inflammation occurs when plaque builds up on your teeth and along the gum line. When this happens, the bacteria in plaque produce toxins and other harmful substances that irritate the gum tissue, causing it to become red, swollen, and prone to bleeding. Think of gingivitis as your body's warning signal that something isn't right with your oral health. Unlike more advanced forms of gum disease, gingivitis affects only the gums and not the deeper supporting structures like bone and ligaments. So gingivitis marks the initial stage of gum disease, sometimes called periodontal disease. If left untreated, the inflammation can progress beyond the gums to affect the bone and supporting structures around your teeth, developing into periodontitis. At this more advanced stage, the damage becomes irreversible and can eventually lead to tooth loss. However, with proper oral hygiene and treatment, the damage caused by gingivitis can be completely reversed. Symptoms of gingivitis. Gingivitis often develops silently, with subtle changes that you might not immediately notice. The most common and earliest sign is bleeding gums, particularly when brushing or flossing. Many people mistakenly believe that bleeding happens because they're brushing too hard, when in reality, healthy gums shouldn't bleed with normal brushing and flossing. Even slight bleeding warrants attention, as it indicates inflammation. Alongside bleeding, you'll likely notice changes in the color of your gums. Healthy gums appear light pink and firm, while inflamed gums take on a duller, deeper red or even purplish hue. This color change might be generalized throughout your mouth or localized to specific areas where plaque accumulation is greatest, like around certain teeth or in the back of the mouth where cleaning is more challenging. Swelling also occurs as inflammatory fluids accumulate in the gum tissue. Your gums may appear puffy, with the normally knife-edge margin where they meet your teeth becoming rounded or bulbous. This swelling sometimes causes the gums to partially cover the teeth, creating small pockets where more bacteria can collect and worsen the condition. Many people with gingivitis experience tenderness or discomfort, though surprisingly, the condition can be painless even with significant inflammation. When discomfort does occur, you might notice soreness when brushing or when eating crunchy or acidic foods. Bad breath or a persistent, unpleasant taste in your mouth also often accompanies gingivitis as bacteria multiply below the gum line. As gingivitis progresses, you might notice your gums receding, making your teeth appear longer than before. Gingival recession exposes the tooth roots, which can lead to sensitivity to hot, cold, or sweet items. Causes of gingivitis. Like what we said, gingivitis develops when plaque accumulates on the teeth and along the gum line. This plaque forms when bacteria in the mouth mix with food particles and saliva, creating a sticky film that adheres to the tooth surface. If plaque is not removed through regular brushing and flossing, it hardens into tartar, which can only be removed by a dental professional. Tartar creates a rough surface where bacteria can thrive, leading to gum irritation and inflammation. Even with good intentions, using improper brushing techniques or worn-out toothbrushes can leave significant amounts of plaque behind, particularly in hard-to-reach areas between teeth and under the gum line. Smoking and tobacco use also increases your risk because they weaken the immune system and reduce the ability of gum tissue to heal. Other than that, hormonal changes, such as those occurring during pregnancy, puberty, menstruation, and menopause, can make gums more sensitive and susceptible to inflammation. Finally, genetic factors make some individuals more susceptible to gingivitis despite good oral hygiene. Research suggests that up to 30% of the population may have a genetic predisposition to gum disease, requiring more vigilant care to maintain gum health. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of gingivitis. Diagnosing gingivitis typically occurs during a routine dental checkup. Your dentist or dental hygienist will begin with a thorough examination of your gums, noting their color, texture, shape, and whether they bleed easily when gently probed. A key diagnostic tool is probing depth measurement, which involves using a small instrument called a periodontal probe to measure the space between your gums and teeth. In healthy gums, this space is typically 1 to 3 millimeters deep. Deeper measurements suggest that gingivitis may be progressing to periodontitis, while normal measurements with other signs of inflammation confirm gingivitis. Dental x-rays may be taken to check for any signs of bone loss or deeper gum infections, particularly if periodontitis is suspected. In some cases, the dentist may evaluate plaque and tartar buildup using a special dye that highlights the areas where bacteria have accumulated. Treatment for gingivitis. Treating gingivitis focuses on removing the cause of gum inflammation and restoring proper oral hygiene practices. Number 1. Professional dental cleaning. The cornerstone of gingivitis treatment is professional removal of all plaque and tartar, called scaling. During this procedure, a dental hygienist uses specialized instruments to carefully clean above and slightly below the gum line, removing deposits that can't be eliminated by brushing and flossing alone. The cleaning might feel somewhat uncomfortable if your gums are sensitive, but local anesthesia is rarely needed for basic gingivitis treatment. After scaling, the hygienist typically polishes your teeth to remove stains and create a smoother surface that's more difficult for plaque to adhere to. This professional cleaning not only removes current irritants, but gives you a clean slate from which to improve your home care routine. Number 2. Home oral hygiene. Your dental professional will provide specific instructions on improving your daily oral care routine. This typically involves proper brushing technique using a soft bristled toothbrush at least twice daily, with emphasis on angling the bristles toward the gum line where plaque tends to accumulate. Daily flossing or using interdental cleaners is crucial for removing plaque between teeth where your toothbrush can't reach. Your dentist might recommend specific tools like interdental brushes, water flossers, or floss holders if you have trouble with traditional flossing. An antiseptic mouthwash may also be recommended to help reduce bacteria and inflammation in the gums. Number 3. Antimicrobial therapy. To help control bacterial growth, your dentist might recommend antimicrobial mouthwashes containing ingredients like chlorhexidine gluconate. Unlike over-the-counter cosmetic mouthwashes, prescription-strength rinses actively reduce bacteria and can help control inflammation while your gums heal. These are typically used for a limited time, usually 1 to 2 weeks, due to potential side effects like temporary taste changes and staining with prolonged use. In some cases, antimicrobial toothpastes containing triclosan or similar ingredients may be suggested to provide ongoing antibacterial action during regular brushing. Number 4. Lifestyle and dietary changes. Making lifestyle changes can significantly improve gum health and aid in the treatment of gingivitis. Quitting smoking is one of the most important steps in reducing the risk of gum disease and allowing the gums to heal. Eating a balanced diet rich in vitamins and minerals, particularly vitamin C, also helps strengthen gum tissue and support the immune system. Drinking plenty of water and avoiding excessive sugary foods and drinks can also prevent plaque buildup and bacterial growth. Number 5. Regular dental visits. After initial treatment, regular follow-up appointments help ensure gingivitis doesn't return and allow for prompt intervention if it does. Your dentist will establish an appropriate interval for professional cleanings based on your individual risk factors, ranging from every 3 months for those highly susceptible to gum disease to every 6 months for most patients. At the end, with proper treatment, gingivitis is completely reversible, usually showing significant improvement within days to weeks. Prevention of gingivitis. Preventing gingivitis largely involves maintaining good oral hygiene. So try to brush your teeth thoroughly at least twice a day using fluoride toothpaste and a soft bristled brush. Pay special attention to the gum line, angling your brush at 45 degrees to clean where plaque tends to accumulate. Clean between your teeth daily using floss, interdental brushes, or water flossers. This step removes up to 40% of plaque that brushing alone leaves behind. Replace your toothbrush every 3 to 4 months or sooner if bristles become frayed. Worn brushes clean less effectively and can even irritate gum tissue. Now, we want to hear from you. Have you ever dealt with gingivitis? What changes did you make to improve your gum health, and did they work for you? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.